I want to introduce myself. So my name is Nicola Cockerton and I'm the MBA Program Manager at UCL Global Business School for Health, and welcome to our open day today. I have the Director of the Executive MBA Health, Satiris, and he'll be doing a presentation. We'll be having questions at the end. There is a question and answer area at the bottom of your screen. So if you put any questions in there, and then at the end, we'll go through them. Thank you. I'll pass it over to Satiris.
Thank you, Nicola. Hello, everyone, and nice to virtually meet you. I'm Satiris Vanderos, Professor of Health Economics here at UCL at the Global Business School for Health and Director of the Executive MBA Health Program. So today I will be presenting the program. I will be talking about a few things relating to the program, and in the end, we will open it up for your questions. So, what are we going to talk about today? Well, first of all, we're going to provide an overview of UCL and our school, the Global Business School for Health. Then we're going to discuss why would somebody want to do an MBA, and particularly in health. We're going to present careers options. We're going to talk about the Executive MBA Health program details, a bit about scholarships, and then finally we'll close with some questions. So let's talk a bit about UCL to start with. So it's a very highly ranked university, ranked among the 10 top universities in the world globally. We have 30 Nobel Prize winners. We are ranked second in the UK for research power. We have lots of programs, 430 undergrad programs, 720 postgraduate programs. We have 11 academic faculties, 51,000 students, 16,000 employees, and more than 150 nationalities represented by student body, a truly global university. Now, UCL has been around for a long time, 200 years, and prides itself in disruptive research, highly ranked and disruptive research. Now, particularly our school, the Global Business School for Health, was founded in 2021, so quite recently, but the timing was, very relevant with all the challenges with the health systems and the pandemic and everything. So we are based in a state-of-the-art campus in UCL East in East London, while our main campus is in Bloomsbury in central London. We offer a number of programs, including PhD, DBA, 3 MScs, the full-time MBA Health, and the part-time Executive MBA Health. Now, interestingly, we are the first business school dedicated entirely to health in the world. So we are a pioneer in that sense. And our mission is to engage in health and healthcare management research and education, providing high quality education and high quality research on cutting edge topics. Now, the context is very relevant, and the establishment of the Global Business School for Health was very timely. It was just during the COVID pandemic, when the challenges were massive for public health and health systems. There's a lot of strain on health systems, capacity issues, waiting times, rising costs, and of course a shift to telehealth. We have a cost of living crisis at the same time. We have aging, which poses a great challenge to health and healthcare, and of course financing health systems. We have increasing costs, of course, cost of healthcare, and then all the socioeconomic determinants of health that come with this, that affect health and healthcare. And of course, there's an effort to expand universal healthcare to as many countries as possible. So a very, very relevant context. Now, why would somebody want to do an executive MBA? Well, it provides new career opportunities, right? It helps someone develop professionally and personally. There's a lot of interesting things one can learn, especially related to management and related disciplines, but also in the context specifically of healthcare in our case. There can be a shift from focus on individual contribution to strategic leadership and management of others. And of course, there's a potential to build a portfolio career or pivot in your current career. Most executive MBA students are looking for an experience that goes beyond content and takes them to the next level. For example, the boardroom, policymaking, and change management. So what are the benefits of an online executive MBA? Well, you can learn flexibly, right? You don't have to pause your career. You don't have to stop working. You can carry on working and at the same time study. And flexibly, meaning that you don't have to be based in London in order to join this program. As the material is delivered online, we have pre-recorded, but also live sessions. Of course, we do have an in-person week in year one and an in-person week in year two, but I'll come back to that a bit later today. Now, it's very important that there's a focus here in this program on the healthcare area of management. It helps develop critical thinking, technical and soft skills for executive roles, and provides the credibility and confidence to frame complex challenges. Importantly, it's interdisciplinary and provides cross-sector approaches. So usually people who would be looking for an executive MBA would be mid-career, people who are looking to reboot after years of working. Now, what makes our program, our Executive MBA Health, stand out? Well, we understand the healthcare sector. Healthcare sector is massive and growing. It's a sector that's constantly requires more and more of our GDP. And here at the Global Business School for Health, we know health very well because health is integral in all we do. Our programs have been specifically designed for healthcare leaders with cutting-edge contemporary topics. And we also have an executive in residence program of CEOs and former CEOs in healthcare ready to mentor and engage with you for career advice and opportunities. We also have a recruitment agency working with us to help evaluate and work with you to ensure you achieve your expectations from this program. And of course, there's a network of UCL alumni, and you also have access to executive education programs at GBSH at reduced rates. And of course, you'll create networks and connections worldwide that will last you a lifetime. Now, typically, an EMBA Health student would be mid-career. They would have a good academic or clinical background with work experience, either alongside training or full-time. Of course, ambitious and determined, looking to build out in healthcare management, pharma, biotech, or consultancies or other areas, and with an eye on accelerating their career and looking to gain a network of international healthcare peers. Now, a number of career opportunities after completing an EMBA. Of course, you can carry on with your existing job with an opportunity to accelerate your career, move to the next level, for example, C-suite roles, CEOs, and so on. Other options include health consultancies or general consultancies like the Big Four consultancy firms and others. Senior management roles in big pharma, biotech, sectors that are booming, and of course, public and private healthcare spaces such as the NHS, BUPA, WHO, and other global organizations. Now, of course, some people might want to follow a different role like health tech, med tech, startups. They might want to set up their own business. They might want to be entrepreneurial, or they might want to go into academia or other roles, or of course, legislation and policy roles. Now, the program is a 2-year program. It starts in September 2024, and the duration is 2 years, 24 months. It is online, but we have 2 residential weeks, one in year 1 and one in year 2, where you have an in-person experience. In year 1, it's in the UK. In year 2, it's in a country abroad. The tuition fee is £45,000. Now, here's what the program looks like. Of course, all this information is available online on our website. These are the provisional dates because the academic calendar is yet to be finalized, but this is roughly what the program will look like. We start with an induction in the last week of September, followed in year 1 of block 1 on teaching strategy, people, and marketing. So you get 2 weeks of strategy, 2 weeks of people, 2 weeks of marketing, and 2 weeks wrap up. Then block 2, after the holiday, would be finance, economics, and data, where again, you get 2 weeks of finance, 2 weeks of economics, 2 weeks of data, followed by 2 weeks wrap up. That's in January, February. And then you have the in-person week in the UK, which is an excellent opportunity to have a deep dive into the UK health system. There are lots of visits to organizations, a lot of talks by different speakers, and of course, an opportunity for students to come together and exchange views, discuss, debate. Then in block 3, we have the Global Health Research Project. That's in year 1. Then we also have a year 2, where you start in block 1 with executive leadership, followed in term 2, in block 2, by contemporary topics in health and healthcare, then the in-person week abroad in some other country, and then finally the the health consultancy project. So about the 2 projects, the Global Health Research Project in year 1, you work in a group and you identify areas of needed health improvement through research and develop a health idea or innovation in response to this. So you would bring together the learning from across the program, and doing desk-based research, you would create an original piece of research building on the various strengths of your fellow team members. Now, in year 2, at the end of the program, we have the Health Consultant Project, which is very interesting indeed, where you would work independently or in a small group, depending on the project, to shape and engage on a problem opportunity that needs addressing by the health client. You will work with a career coach to find a good fit for your career ambitions, and you agree on a consultancy report which you deliver with your partner organization. Now, in terms of admissions, well, now's the time to apply. We're not too far from September. So if you haven't submitted your application yet, it's a good time to do so. Typically, we would ask for a UK minimum of an upper second class degree or an overseas qualification of an equivalent standard. But of course, people who might not have this exact equivalent, but they might have extensive work experience, will be considered on an individual basis. We do have language requirements, of course, the IELTS. In terms of work experience, usually we ask for a minimum of 5 years work experience. And we also invite candidates who meet the requirements to an interview. And of course, there's a personal statement and 2 references. And you can apply online through the UCL website. Now, in terms of scholarships, you might seek scholarships from various sources. Sometimes, often, employers might fund the program for their employees, but also there's a wide range of other places that somebody might look for funding, either within UCL or outside UCL. There's a number of places like Commonwealth Funds, Fulbright, and so on. So you can use this website, ucl.ac.uk/scholarships/scholarships-finder, which can help you find any potential scholarships. Now, we offer career support. We have a fully online self-paced primer course and a tailored induction package. So we help people with this. And of course, during the induction, we focus on personal development, organizational behavior, and team building. And of course, we have personal tutoring and one-to-one careers coaching. Now, we have a student union with over 250 clubs and societies. We have a student support and wellbeing team. And of course, we have the student union advice service. And of course, during the study week, the in-person week in London and a different country, we have, it's a great opportunity to visit London if you are not based here. So London is a magnificent city with lots of things to do, lots of attractions, and so on. Now, if you want to find out more about our school, you can find us online. You can find more information about the Global Business School for Health and about UCL and about our Executive MBA Health program. You can find that online. And of course, we will now open this up to questions. Happy to answer your questions. Please post your questions in the Q&A tab at the bottom of the screen. Please provide your name with your question. So if we are unable to answer it in session, we will try to respond via email. So yeah, please submit your questions and I will answer these. Okay, we have a few questions coming in, so I'm gonna ask them. Typically, we have about 3 or 4 hours of live sessions per week, but we also have corresponding pre-recorded material available online. So there's part of the material you can watch online. You can follow online on Moodle, on our webpage where we post the material at your own time. And then we also have live sessions where we include discussions and debates. So typically we have about 3 or 4 hours per week of live sessions and also a number of videos for you to watch online and other activities. Live sessions, usually these tend to be around lunchtime, London time, which helps accommodate people in different time zones, and also those based in the UK or Europe to do this during their lunchtime, about 1 to 2 p.m. or 1 to 2:30 p.m. on Tuesdays, Wednesdays, Thursdays. But that's subject to that's something that will be confirmed soon. Now, in terms of backgrounds, different people from different sectors, different backgrounds, NHS, physicians, consultancies, public sector, private sector. Now, there's a question here about the benefits and advantages of somebody doing this MBA for somebody in pharma and biotech. Well, especially in large firms like big pharma, for example, or biotech, this helps combine the very important skills for somebody wants in a senior role or a managerial role or a senior directorship or something, or CEO. The skills like leadership, like human resource management, like strategy and management. These very, very important skills for managing these large companies, and you combine them with the health skills and adapting them particularly for the health sector, which makes this program stand out and exactly very, very relevant to people who do work in these industries. It's not exactly 10 hours per week. It usually tends to be, in terms of live sessions, tends to be around 3 to 4 hours per week, as I said early on. And the schedule to be confirmed, of course, is what I mentioned early on. We do record live sessions, but that's not a perfect substitute for. So if you occasionally have to miss a session, that will be recorded, but it's not a perfect substitute in terms of like entirely substituting the live sessions with pre-recorded ones. About the first year visit will be in London, in the UK. Second year to be confirmed. I mean, for the current cohort, we're taking them to the US in the second year. For the next cohort, we'll see if we would do the US trip again, or we will visit some other place in the world. Any other questions? I'll give it a couple more minutes for any more questions to come in. So the next intake is again in next year. So if you want to join in September 2025, so currently we're recruiting for September 2024. So if you want to apply, please do so soon. Um, if you want to join the next cohort starting in September 2025, then that would we will start recruiting for that from October or November. I think November 2024. That's when we will open the applications for the next year. So we can have the interview virtually online, and the sooner you submit your application and have the interview, the sooner you will hear back about the outcome of your application. Now, the full-time program is different because you would have to pause your career or make amendments in the sense that the full-time program requires full-time study. So you would probably be able to work part-time, but you won't be able to carry on working full-time. So, and also the full-time program is in person. So you would have to be based in London, while the Executive MBA Health gives you the opportunity to carry on working full-time and also to join from elsewhere in the world as well. So that's an advantage, allows you to carry on with your career and also learn flexibly online, even if you are based outside London. Now, of course, balancing both can be challenging, but we offer support, and with the right balance between studying and working, I'm sure you'll be able to thrive in this program. And we do also expect employers to show some understanding. And this is also for the benefits. They will also benefit from your studies. So, having their staff trained is very important. And of course, allowing you to have an hour here or there to study will be in their benefit as well. So we do expect employers to show some understanding, as this is definitely important for career development. Well, this another question. The sooner you apply, the sooner you'll hear back. So if you submit your application soon and it's reviewed soon, we'll review it soon, and then we'll arrange an interview. The sooner that can take place, we can probably offer you. We can probably get back to you with the outcome of the application within a few days, a week or so. So yeah, the sooner you submit the application, the sooner you will hear back. And scheduling the interview is also important. It will help make things run faster. Yes, IELTS is mandatory for those who do not have any other way of. There are some. I mean, for example, if you hold a university degree from for example, if you have a first degree from UCL or another British or American university or other university which has the language of the language is English, you can, of course, you don't have to take an IELTS, but otherwise, yes, we do require an IELTS. In terms of assessments, there's a question here about assessments. Now, for every block, you have an assessment. It depends, of course, on the module. But yeah, expect an assessment for each module, for each block. Now, it depends on the module, and there might be a combination. There might be assignments, there might be a presentation, there might be an online exam. But yeah, expect at least 1 or 2 assessments per block. And of course, we have the projects each year, which is a piece of work project, which you submit, which you prepare and you submit. We have primarily we have assessments, but this year we also had an online written exam. But a lot of them has to do with assignments. Well, how much time you will be dedicating depends on you. Well, of course, you have to follow the live sessions and also watch the pre-recorded material and engage in the activities. Now, how long that will take you depends. But yeah, expect 3 to 4 hours of live sessions a week and another few hours every week for the pre-recorded material and preparation and everything. Okay, thank you all for your questions. And we look forward to receiving your applications, and then we'll get in touch to schedule an online interview, and then you will be hearing back from us. Thank you, and hopefully see you soon. Bye-bye.